Hello, my name is Ashish Bhimani, and I'm one of the physicians specializing in heart rhythm disorders at Piedmont Heart Institute. I'd like to talk to you today about atrial fibrillation. First, let's talk about the normal cardiac anatomy. So the heart is made up of 4 chambers. The 2 upper chambers are the atria, the right and left atria, and that's where the blood comes back from the body to return to the heart. The atria then squeeze the blood into the ventricles, and the ventricles, the RV and the LV, will then squeeze the blood back out to the body, starting the cycle over again. Now, normal cardiac conduction is generated by electrical signals that then cause the heart muscle to contract. So you can imagine a rock falling into a pond in that smooth activation pattern that we see. And that's how electrical signals normally travel. They travel in a smooth, organized pattern, and that smooth, organized pattern can generate an efficient squeeze for each chamber. So let's look back at our schematic. Now, a normal heart rhythm we call normal sinus rhythm because the signal is typically generated from the sinus node. That signal then emanates out and moves in that smooth, organized pattern throughout the atria. That causes the atria to squeeze the blood into the ventricles. The signal then goes to the ventricles squeeze and pump the blood out to the rest of the body. Now, in atrial fibrillation, the electrical signals in the atria become rapid, disorganized, and chaotic. And here's an example of what that might look like in the water. Instead of that smooth signal, just a lot more of a mess electrically. Here's that schematic again, and you can see the signals are moving all around the atria and not any kind of organized pattern. And that disorganized activity leads to twitching or quivering of the atria, so you get no effective squeeze. Now, those signals can then activate the ventricle in an irregular and somewhat rapid way. Fortunately, the ventricles still squeeze normally, and that's why atrial fibrillation is generally not a lethal arrhythmia, but the fast and irregular pulse can still cause quite a lot of problems. So let's talk about the consequences of AFib. Well, you have a loss of your atrial pumping function. You can also get that rapid and irregular heart rate. And in a lot of cases, AFib can ultimately lead to heart failure. And these 3 elements really drive a lot of the symptoms of AFib. There are a couple of other issues too, though. There can be blood pooling because you're not having that effective squeeze, and that can increase your risk of stroke. And there's also the idea that AFib will actually promote the development of AFib going into the future. As far as symptoms are concerned, some people actually have no symptoms at all, but others can have some or all of the following: palpitations, chest fullness, lightheadedness, shortness of breath, tiredness, or lack of energy. And some people can feel pretty miserable with their symptoms of AFib. We'll talk about the stroke risk as well. There's an outpouching of the left atrium called the left atrial appendage. And in this area in particular, when the atria are not squeezing, the blood can pool and form a clot in this location. The clot, if it gets dislodged, can then travel to the brain, which can cause a stroke. Now, each individual has a different stroke risk, and we can calculate that based on certain risk factors. The final thing we want to talk about is the progression of AFib. In general, the AFib episodes will promote the future development of AFib episodes, and that's shown on this schematic here. Each orange bar represents an episode of AFib. So starting on the left, imagine you had an episode of AFib, it lasted a few minutes, and then it stopped on its own. You may go months or even years before another episode occurs. But then you may have 2 or 3 episodes which occur with a little more frequency, and over that time the episodes may get longer and longer. We can classify this as paroxysmal AFib, when people have AFib that comes and goes on its own, with the episodes lasting less than 7 days. When the episodes get longer and last more than 7 days, or require some kind of treatment to stop them, then we call that persistent AFib. And sometimes the episodes will continue indefinitely, and we can call that permanent or continuous AFib. Hopefully that gives you a good background on atrial fibrillation. Obviously, there's a lot more to talk about in terms of how we manage AFib, but we believe that the management of AFib requires a comprehensive and individualized approach. If you or a loved one has atrial fibrillation, we would be happy to help. We have providers and locations throughout the state, so please check out our website below or call us for more information.